Hi, I'm Dr. B, a board-certified pediatrician and pediatric critical care doctor, and I'm here to tell you 5 things you can expect if you're in the hospital with a sick child with RSV bronchiolitis. So 1, as you go into the hospital, expect to be placed on a monitor because we want to look for, the vital signs and look at what the oxygen sat level is. Number 2 is depending on what your oxygen sat level is and also the work of breathing of the child, is going to be placed on oxygen. So if the SATs are below 94%, or even if the SATs are normal, if the child is working really hard to breathe, we usually will put on oxygen. So the oxygen can be in the form of just a simple nasal cannula, or it's something called a high flow nasal cannula. You may hear that. The high flow is just you can give higher flows, and this would be particularly done if a child is really working hard to breathe. So oxygen is next, and then followed by number 3 is obtaining IV access. So we would put an IV in to get some IV fluid going, because a lot of these children are really struggling to breathe, so then they don't drink as much and end up getting dehydrated. So typically IV access would be placed next. And then number 4 is once we are doing the IV access, we tend to get some blood work done as well, look at the chemistry, the CBC, and then maybe get a chest x-ray just to see if there is any kind of superimposed pneumonia on top of that. And then also expect to see a swab done in your nose just to look for what type of virus it is. Most commonly it is RSV. However, we have the full panel which can check for RSV, adenovirus, rhinoenterovirus, which is what we are commonly seeing nowadays. So those are part of the investigations. And then lastly, number 5 is expect to see your child being placed on some breathing treatments with albuterol. Some kids will respond really good to the albuterol, so then they get placed on intermittent dosing of albuterol, like every 3 hours or every 4 hours. And then some children may not respond the greatest. However, there will be a trial of some kind of breathing treatment. And then also the nose will be suctioned out really good. So there you have it. Those are the 5 things that you would expect to see if you happen to have a child who's really sick with bronchiolitis. I hope that helps. Thank you.